Today we will show you an innovative and effective treatment for acne scars using the OneNeed Pro microneedling device by Campomats, together with a unique single-needle cartridge, a patented feature that allows extreme precision, and which only Campomats offers. This treatment is an excellent alternative and complement to laser therapies. It can be done all year round, has a very short downtime, is well tolerated, and is cost-effective both for the patient and the doctor. Our patient has a history of severe acne, treated also with oral therapies in the past, which unfortunately left deep scars. We start with a careful skin assessment, identifying the areas where the scars are most visible. Next, we proceed with complete skin disinfection using pre-soaked chlorhexidine pads, sanitizing towels from OneNeed Pro line, which have a smooth side for general cleansing and a rough side for deep cleaning of the pores. This step is essential to avoid contamination and prepare the skin. To ensure maximum comfort, we apply a topical anesthetic cream, focused only on the areas to be treated. We then use an occlusion mask to enhance its action, and leave it on for about 15 to 20 minutes. Now we prepare the OneNeed Pro device. We show the patient the sterile single-needle cartridge, which we screw onto the handpiece. This cartridge is exclusive to Campomats and allows a regulated depth from 0 to 2.5 millimeters, directly from the handpiece, a key feature for tailored and safe treatments. We set the depth to 1 millimeter to begin, and the speed to maximum for smooth and effective action. We begin by working precisely on the scarred areas. The needle is inserted at an angle of about 30 degrees, performing a subcision technique to undermine the fibrotic tissue beneath each scar. This mechanical action breaks down old collagen and triggers the skin's regeneration, promoting the formation of new, softer collagen. A small amount of bleeding is a good sign of effective treatment. In wider scars, we may work perpendicularly to reach the depth of the lesion. Once microneedling is done, we dab the skin and proceed to deliver linear hyaluronic acid through the microchannels we just created. This allows deep skin absorption and enhances the regenerative process. We're using a concentration of 20 milligrams per milliliter in this case. To complete the session, we apply a highly soaked mask with exosomes and soothing ingredients. It is the Exosome Biomask from OneNeed Pro line. Even when only hyaluronic acid is delivered, this mask boosts the synergistic effect of the treatment. The patient experiences a pleasant cooling sensation, and the mask is left on for 10 to 15 minutes. After removing the mask, the skin appears calm and slightly red, but the patient reports minimal discomfort and a pleasant sensation of freshness. No makeup for 24 hours is recommended, and daily SPF is essential. This technique allows visible improvement from the first session, and is a powerful complement or alternative to laser therapy, with minimal downtime and high satisfaction. To achieve the definitive result of seeing scars disappear and having smooth skin, your doctor will perform several sessions, spaced approximately 1 month apart for a minimum of 3 or 4 sessions up to a maximum of approximately 10 treatments.